If you want to know about healthcare costs and expenses, one of the best places to start is contractual allowances. One of the reasons why is because contractual allowances is what is negotiated downward from the top line costs that are given to insurance companies and patients. And so, contractual allowances and the process by which you arrive at a contractual allowance is the negotiating process by which hospitals and providers will negotiate with insurance companies in order to arrive at a cost and a price that is acceptable for both parties. As patients who are not involved in this process, it is very confusing because patients will often see a top line charge that's not negotiated downward and don't know where to take that top line charge. And oftentimes they won't be able to negotiate on their own behalf and will rely on their insurance company to negotiate the appropriate costs that the healthcare provider will then accept. Now, one of the things within this analysis that we found very interesting is that contractual allowances are trending upward, and they are trending upward in a very drastic fashion that we don't see coming down anytime soon. What this means is that if contractual allowances on a percentage basis increase, then you will continue to have this negotiating dynamic between hospitals and providers on one hand, and then insurance companies on the other. And as contractual allowances increase, what this means is that hospitals and providers will charge more and more and more, and patients will rely on insurance companies more and more and more to negotiate downward to an acceptable cost. And so without further ado, let's get into this analysis, which comes from data from cms.gov. If you want this analysis, then you can go to arcosanalytics.com/reports, go to the bottom of the page and access this dashboard, or we will leave a link below in this video where you can access it yourself. Now, first, what I'll tell you is that this analysis comes from cms.gov and is really part of an entire data set that looks at many specific aspects of healthcare. And contractual allowances is just one piece of the puzzle. And so, one of the things we found interesting is that by state, it varies greatly. And so, if you live in, let's say, Nevada, Florida, or New Jersey, then your contractual allowances are north of 80%. What this means is that if you live in any of these three states, if you walk into any hospital, then you can expect a contractual allowance or a decrease in your top line charge of 80% and be negotiated by your insurance company. So if you don't have an insurance company, you may be missing out, and you probably are missing out on that 80% discount because hospitals will automatically give you that top line charge and expect you to negotiate down. But insurance companies essentially have enough volume to be able to negotiate down to the lowest rates. And so that's how contractual allowances work. Now, there are other states at the bottom here, like North Dakota, Montana, Maine, and Maryland, where theirs are extremely low. Maryland is an outlier where the contractual allowances for Maryland are 12%. And so what this means is that in contrast to having an 80% discount, if you walk into any hospital in Maryland, then you're going to have a 12% discount, which is, I suppose, reasonable, but it depends on the total costs of healthcare within Maryland. Now, the next states are North Dakota, Montana, and Maine, and Vermont, and it goes up on the list. But even these states, which are the lowest or one of the lowest, still have contractual allowances of 45 to 50%, which is still quite high, but that's the world we live in. Another thing I found extremely interesting is that you have all of these states here, but on an average basis, you'll have the states in the Northwest, which have a lower contractual allowance than the ones in the South. And so the ones in the South certainly have high contractual allowances, north of 75%, including Arizona, Texas, Florida, and all of these states. And one of the reasons I would suspect why is because you have more retirees in those states who need a procedures that are obviously at a higher cost. So then you will obviously negotiate down even more. And so I thought that was very, very interesting that you have Maine, you have these northern states up here that don't have high contractual allowances and they're more in line with the average, but then your southern states have very, very high contractual allowances. And we can see that in the data when we go to the state and the specific hospital level. Now, the other thing that I find very interesting is that when you look at contractual allowances on a trend basis, then what you'll find is that the gap between your total costs within a hospital or within a clinic is increasing at a steady rate while your contractual allowances are increasing at an even greater amount. And so, one of the ways we're able to measure contractual allowances is because we can measure the total hospital charges that hospitals charge on an aggregate level across over 5,000 hospitals. And then we can take the net patient revenue, which is what we assume is the revenue that the hospitals bring in on an aggregate basis. And so, as you can see, in 2011, you had hospital charges of $2 trillion, and the net revenue on this was around $700 billion. Now, today, you have total hospital charges that are $4.6 trillion and really close to $5 trillion. And you have net patient revenue close to $1 trillion. And so net patient revenue really increased from 700 billion to $1 trillion in 10 years, while the total charges increased from two to five. So it's almost more than doubled as far as hospital charges are concerned, while the net patient revenue did certainly not double. Another way to look at it is on a percentage basis. And so if we take the hospital charges over net patient revenue, then we get what we're arriving at our assumed contractual allowance. And so as you can see within this chart, it is increased by, let's say, 66%, all the way north of 80% in 2022. 75%. And so, as you can see, this trend has increased drastically, where before it was at 66%, and it's gone up a whole 10% in the past 10 years. And it's leveled out, but my expectation is that in the next 5 to 10 years, it will certainly increase, and we could see contractual allowances close to 80%, certainly 68 to 69% by the end of this decade, which is quite astounding, but that is the world we live in. And so when people ask about alternate ways of paying for healthcare, I would point right to the contractual allowances. The higher the contractual allowance percentage, the more you have to rely on insurance companies to negotiate, and the more negotiating power they will have to bring those healthcare costs down. And then you have this relationship between hospitals and providers and insurance companies that essentially makes sure that this process is more and more enforced as contractual allowances increase greater and greater. Okay, so that's the overview. We've talked about contractual allowances by state, and we've talked about the trend, which is very, very astounding and very, very stark, where contractual allowances are increasing on a percentage basis year over year. Now, if we look at it by hospital, it's quite interesting to look at. And there's quite a jumbled mess here because we can look at a series of hospitals, what their net patient revenue is per discharge, what their contractual allowance is on a percentage basis, and what their revenue is on an aggregate basis. And so let's look at a few states to see how this pans out. And so one of the states I like to look at is Texas. So if we put in Texas here, for example, one of the things that we'll see in our map is that Texas certainly has a lot of hospitals, but when we go down to a city, like let's say we want to choose Houston, which um, is a hub for healthcare. When we look at this, then obviously we get a map of all of the locations where we have data for, and then you can see essentially where your net patient revenue per discharge is. And so for example, Victory Medical Center in Houston has the most patient revenue per discharge. And so for every discharge, the revenue that's coming in is 64%. Likewise, if you look at UT Anderson Cancer Center, then you can see the trend below of the discharge trend and the net patient revenue per discharge, which is quite high because in 2011 it was 33,000 and now the revenue is 44,000. So it increases drastically. Um, then you can look at certainly a series of other hospitals and kind of understand what their net patient revenue is per discharge. Now, again, the net patient revenue is the amount that the hospital collects after the top line charge, but it's helpful to understand how this works. One of the things I did find very interesting is that on a contractual allowance percentage, some hospitals are better equipped than others in terms of contractual allowances. And so this Texas Doctors Hospital, which is a very, very small hospital, has a negative contractual allowance, which means that if I can think about this, what this means is that for everything that's coming in, they are actually receiving more than what that negotiating is. So my guess is that in this case, they are doing a lot in terms of Medicare and Medicaid and don't really deal with insurance companies as a whole. Now, certainly there are others in the list. So, for example, Houston Healthcare Medical Center is a big hospital, really in the center of Houston, and their net patient revenue and contractual allowance is 90%. And so, if you walk into this hospital, then you could expect your insurance provider to knock down the top line price by 90%. Something else that's very stark is that on a per adjusted discharge trend, revenue per adjusted discharge, it goes from 12,000 in 2019 to 25,000 in 2022. So in 5 years, it increased by more than 2 times or more than 100%, which is quite stark. Um, Another one is like it's interesting because you can see where it's located, where Houston Northwest is, and then its trend. And so you will see that it's been trending around $10,000 per discharge, and then it came up to $14,000. So not as big as Houston Healthcare, but still very, very large. We can do this with a series of other hospitals, but I wanted to show you specifically what this means for hospitals when it comes to contractual allowances. I encourage you to come and look at this analysis because it's very helpful in understanding what hospitals you're looking at and what discharges you have. And so let's say in my area in Dallas, for example, if I look in Dallas, then I can look at a lot of different hospitals, which Baylor is certainly one of them. But the one that has a high net patient revenue per discharge is UT Southwestern. Interestingly enough, um, their discharges have come down since 2017, and so I look at the data to see why is that the case. Um, Dallas downtown certainly has a high revenue per discharge, but then you also have to look at on the other end, you have to look at allowances by hospital to understand what their contractual allowances are and why contractual allowances are so high. So I encourage you to come and take a look at this analysis at the hospital level, because the data is quite interesting, and I think there's a lot to glean from the data in terms of what it means in terms of a specific hospital and their overall trend. Now, if we look at contractual allowances by system, this is an entirely different way to look at it, because if you have specific hospitals, many and or most hospitals um, go and are aggregated into systems that then negotiate with insurance companies in order to receive revenue and negotiate a rate that is acceptable. And so again, let's look at, let's say, California in this instance, and then we can see that Sutter Health is certainly one of the largest systems that brings in the most net patient revenue. But again, it just depends on how you want to look at it, because there are, let's say, there's a series of independent hospitals that you can choose from. But if you look at, let's say, like the University of California system, there are a series of hospitals here, and we can choose, let's say, University of California Health. We can look at that and say, okay, their net patient revenue per discharge started at 31,000 in 2011 and has gone to 40,000 nearly in 2022. So the trend has certainly been upward, but maybe not as stark as others, depending on what they're looking for. Dignity Health, on the other hand, you can also see that they have a high contractual allowance percentage of 76%. And then you can see the breakdown of where those hospitals are located. And so it's quite interesting because they don't all aggregate in a specific city within California, but they certainly trend in specific directions depending on what you're considering. Um, Another thing that I'd encourage you to do is that some of these hospitals have a contractual allowance of nearly 100%, which I don't quite understand why they would have such a high percentage, um, depending on what you're looking at. Some of them would have a high percentage, like MLK, for example, has nearly 100% contractual allowance, and so a lot of times these very, very high contractual allowances is supplied and or helped by government through CMS services in general. But you can also see, one of the things I find interesting is that if you look at, let's say, University of California, then you can look at the breakdown and see where those University of California hospitals are, and then go from there. If you want to look at, let's say you want to look at smaller ones like Community Memorial Health, then that one is in Ventura, California. And so if you look at, let's say, Ventura, California, then you can understand that overall trend. So again, it's interesting to look at it, let's say, at a hospital level, but also at a system level, because systems are essentially the group and or the organization that also negotiates with insurance companies in order to have across the board costs that are acceptable. Another way I like to look at this is by discharge. And so if we look at your total allowances per discharge, then we can see we have data on the far left here that compares all hospitals that we are comparing here. And so one of the things that you will find is that there's a long list of hospitals, and we give you the hospital charges, the contractual allowances, and then the average bill or the average cost per discharge. And so you can literally go here. You can look at, let's say, New York. You can go to New York, look at all the hospitals, know what their total charges are on an aggregate level, what their contractual allowances are, and then their average bill per discharge. And so if you do this, for example, then you can understand that Memorial Hospital for Cancer has the highest cost per discharge or bill per discharge that the insurance company and patient will pay. Likewise, you have New York Downtown Hospital, that's the lowest at $10,000 per discharge. So it's quite interesting because then you can see the total charges, you can see their contractual allowances, and then you can see what the cost is on a discharge basis, which is really, really interesting. And then you can also highlight whatever hospital you want to highlight and see on the other end what your average billing amounts will be per discharge. And so you'll have your total charges, contractual allowances, and then your estimated bill. One of the things I find interesting with a lot of these hospitals is that they trend very closely, but sometimes they will look quite different. And so, for example, Bellevue Hospital Center, you have hospital charges that are high and you have low contractual allowances, which means that you're going to get a high estimated bill, which is out of the normal for sure for that hospital. But if you look at, let's say, a memorial, then you're going to get a trend where you have a trend up for hospital charges. You'll have contractual allowances that also trend as closely as possible. And then you will get the difference, which is an estimated bill. So I think this is quite interesting and quite telling in terms of how this works. At an aggregate level, if you have on average a hospital charge of 63,000, you will get a contractual allowance of 49,000. What this means is that your hospital bill will be $14,000, which is more palatable. And this is how contractual allowances work. You get a total charge, there's a contractual allowance that's negotiated, and then the total bill will either go to the patient, and the patient and the insurance company will then be able to pay that amount. And so I encourage you again to look at this on a hospital level in order to understand what the numbers actually mean. Many people look at a bill and don't quite understand what they mean. They don't really look at CPT codes, or they don't really look at the amounts that are negotiated and how insurance companies negotiate that. But if you have questions about this and you understand how contractual allowances work, then as a patient and somebody who is using healthcare, you will be much more sophisticated than, let's say, 90% of the people who are using healthcare. Likewise, if you are within healthcare, then it is behoove you to understand how contractual allowances work and how they differ by hospital. And so if you are in a hospital, let's say that has high contractual allowances, then you can expect specific behavior from insurance companies and patients than if you have low contractual allowances. And so if you have high contractual allowances, then you will have, let's say, more aggressive negotiations than if you have low contractual allowances from the get-go. And a lot of this depends on the city and state and the kind of hospital or clinic that you are. One of the other things that I have tried to dig into is the relationship between cost to charges and contractual allowances. Now, cost to charges are essentially what it is. It's the total cost to total charge that the hospital has versus the contractual allowance being the amount that is negotiated downward. And so I thought, well, if cost to charge ratios are increasing, what does that mean for contractual allowances? Is there a correlation here? The reason why I ask that is because cost to charges are one of the key metrics within healthcare. And within healthcare, cost to charge ratios essentially determine how much funding specific hospitals and clinics can receive for government services and from CMS related services. And so you can have high cost of charges or low cost of charges, and the preference is to have a low cost to charge ratio. But on the other hand, contractual allowances is the flip of the coin, to where if you tend to have low cost of charges, then you tend to have high contractual allowances. One of the other things I found interesting is that you have a trend where you have cost to charge ratios over time going down. meaning that the top line costs are higher than the charges over time. And so you have higher and higher and higher costs, and then the charges that are then provided are less and less and less. And so this cost to charge ratio means that that if you have greater charges than costs, then your cost to charge ratio is going to go down. And so the more and more and more you charge, the lower and lower and lower your cost to charge ratio is. If your cost to charge ratio is at 0.42%, what this means is that 42% of your costs are what you charge. And so you will charge 42 cents on the dollar for every dollar that you charge. And so if you charge more, then your cost to charge ratio will go down. And so if you charge more, then you'll have a lower cost to charge ratio than you would have otherwise. Likewise, if you charge more at the top line level, then you will also need to negotiate down, or insurance companies will be motivated to negotiate downward. And so if you have lower cost to charge ratios, then you will have high contractual allowances, because these two are similar and related. The difference is that contractual allowances looks at net patient revenue. And so net patient revenue over charges is what constitutes contractual allowances. Cost to charge ratios are your costs over your charges. And so it's looking at a cost basis, where contractual allowances are looking at it at a revenue basis. Now, if we flip cost to charge ratio and make it charges as a percentage of cost, what you'll see is that charges as a percentage of cost go up very closely to contractual allowances. In 2020, it was an anomaly to where charges as a percentage of cost decreased and then came back up. But it's quite interesting because these two trend very, very closely together. And so, what I thought would be very, very helpful was to build out a correlation between the two. How much are cost to charge ratios correlated with contractual allowances? And what we see is that contractual allowances and cost to charge ratios are negatively correlated by 63%. And the way we achieved that, or the way we got to this, was just a correlation coefficient as well as a regression. And so if you can look below, we have a regression here that shows all the hospitals that we plotted out in terms of contractual allowance percentage and a cost to charge ratio. And it's certainly downward, to where if you have a lower cost to charge ratio, you have a higher contractual allowance. The same goes for that negative correlation coefficient. So if we take specific states, then we'll see how correlated cost to charge ratios are with contractual allowances. So if we look at, let's say, California again, what we will see is that there isn't that much of a correlation between cost to charge ratios and contractual allowances, which is very, very interesting. There's a negative correlation of 9.42, but that's not as highly correlated. If we look at, let's say, another state like Georgia, for example, that is more correlated, and there's a higher correlation coefficient here. Even though when you look at the plot below, there's certainly a wide range in terms of cost to charge ratios and contractual allowances for all the hospital systems and health systems within Georgia. We can look at a series of other states, like Missouri, for example, that they certainly cluster and have a higher correlation coefficient. But then you can also see it in the trend basis. And so it didn't trend together until, let's say, 27 and 2018, where the cost of charges and contractual allowances trended more closely. Now, the other way to look at it is the statistical distribution. So if we take a look at the correlation coefficient, there's also a statistical distribution to where there's a skew for cost to charge ratios, where the average cost to charge ratio is 0.38. The median, or the very, very middle, is 0.31, and it deviates by 0.24 0.24. So what that means is that you have a cost to charge ratio across all of healthcare that is pretty much squeezed in between this low amount here, which is close to zero, or 0.6, all the way to, let's say, here, which is zero point 0.9. And so you have a lot of compression in your cost to charge ratio with a few outliers here at the end. And so you have a convergence of a cost to charge ratio of 0.38% on average, and the median is 0.31%. To give it another way, is that the charges are 71% of the costs in this case. And so healthcare providers and hospitals will charge 71% of their cost. Now, on the other hand, contractual allowances have a little bit of a wider range in their standard deviation. And so they deviate by 3.66. And so they have a wider range by which they can fluctuate, but they skew to the upside in terms of what that contractual allowance is. And so on average, you have a contractual allowance of 55.73%. Your median or middle is around 64%, which means that in this range here, you can expect the majority of hospitals to be. But you have outliers where you have hospitals and hospital systems that have lower contractual allowances than what is normal. And so cost to charge ratios are certainly have more of a compressed set in terms of what their costs are and what they charge, but contractual allowances are a little bit more wider because of the way that the negotiating takes place. And so some hospitals may be able to have a greater negotiating power, which means that they can then have higher contractual allowances to be able to provide lower costs to their patients. To close out this analysis, one of the things that we find interesting is that the statistical distribution in terms of the cost to charge ratio and the relationship to contractual allowances is strong. It's not necessarily definite, but there are strong correlations between the two. Likewise, there are differences in contractual allowances by location, by state, by hospital system, and by hospital itself. And so if you are within healthcare and you are working with a specific set of hospitals, then it is behoove you to understand what the contractual allowances are, because this will determine the behavior of insurance companies. It will determine the behavior of patients and them just being very cost conscious. And it will determine overall how an organization, a hospital, or a clinic functions. And so it's very difficult when you're working with patients that don't quite know how much things cost. And so if things cost a high amount and they don't necessarily have the appropriate amount of insurance, then they're going to be a lot more shy than those who walk into a hospital that have the right amount of insurance for any given medical procedure or any service. And so I would say that us within healthcare have to be cognizant of this contractual allowance and the impact it has on healthcare, and understand that as we age in America, and as America on average gets older and older, that contractual allowances will play a bigger and bigger impact. And this is just a matter of fact. And I don't see this trend going down anytime soon. And so it's worth trying to understand this and trying to prepare yourself within healthcare and outside of healthcare for the eventuality that contractual allowances are essentially here to stay. It's certainly a necessary evil, but it's one where it keeps healthcare running on behalf of insurance companies and patients, and then providers and hospitals on the other end. So I hope you enjoyed this analysis. If you want access to it, just click the link below and it will take you straight to this dashboard that has the source of data for the specific dashboard. And if you want to explore more dashboards that we've developed, go to arcosanalytics.com/reports and go to the bottom of the page where we have a series of other dashboards and analysis that we've created. So thanks for watching this specific video, and I hope you gained a lot